So, what are the oral appliances? Well, we have a lot to choose from. And the ones that we choose, that I choose, depends upon what the dentition is. It depends upon how many teeth they have left. It depends upon a number of variables that I'm trying to accomplish with that patient. The good thing is we have a lot of options with oral appliances. They're not new. Oral appliances have been used in some form or another dating back to 1903, where they actually sutured the tongue forward. Well, sewed it to the lower lip. I think that would cause some other problems, but they used helmets and chin straps to position the jaw forward, and you know, so they're not really new in concept. They are definitely new in design. And as I said, they work by bringing the jaw forward, bringing the tongue away from the soft palate. So we have mandibular repositioning devices that bring the jaw forward. We have tongue retaining appliances that bring just the tongue forward. Now, where might we use that? Well, somebody that doesn't have teeth. I need to have a certain number of teeth left in order to put a mandibular repositioning appliance in there. But the oral appliances, the tongue retaining appliances, essentially, well, you'll see one here in a minute, but, and then we have the combination oral appliance and CPAP. And personally, I think this is the way things are going right now. Because if we have a combination of an oral appliance and a CPAP, we don't have to have the air turned up as high, which is going to make the patient happy. And they don't have to wear all of the headgear and everything else. So I think that in fact, in our academy, this is kind of the direction that I see a lot of this going right now. And I think it would be a very good result. So the tongue retainers. Well, if there's not enough teeth, if we have joint pain, so we can't bring the jaw forward without aggravating that, there's snoring or mild apnea. If they have a big tongue, it works well. And then when apnea is worse, lying down, it works well. But that's one of them, okay? You have this big ball out here, and this just fits over the teeth. They make kinds that you don't need teeth, but this happens just to show one where you do use the teeth. And what you do is you stick your tongue out into this ball, and it creates suction. So your tongue is forward, it pulls it away from the soft palate. When I first heard about them, I thought it was probably the dumbest thing I'd ever seen. But they are effective. So, it is a tool for the toolbox. The mandibular repositioners. Well, the big question was, do they work? Before we can suggest somebody consider an oral appliance, we better be confident that they are going to be effective. And so a lot of research went into that. And they don't work 100% of the time, but neither does CPAP. Well, for mild sleep apnea, some of the studies are showing a 76% success rate. For mild, a little less. For severe, less yet. So we really don't like them as a first line of treatment for severe. Do I have severe apneics that I'm treating with oral appliances? Yes. These are people that have failed on CPAP. These are people that have been fully informed that there's an option, but it's not necessarily the gold standard, because we may not be as effective treating you with an oral appliance as with a CPAP. But some people, flat out, are not going to wear a CPAP. Well, then I'd rather have them doing something. I'd rather have them have an oral appliance in there. It may not be quite as effective, but it's going to be a whole lot better than nothing. And I said earlier, we had the non-adjustable appliances. And these lock the jaw into a specific spot. I don't like them. I don't recommend them. I don't even see them talked about much anymore. Then we get into, you know, this one locked it in. Now we have the adjustable ones. And these are the workhorses that I use the most. There's a number of different designs. My biggest workhorse currently is called the Somnodent. And what it does is it's a two-part device. And this goes on the bottom. This goes on the top teeth. And they're adjustable, so we can move the jaw forward and backward. Now, when I first saw these, I thought, that's going to take some getting used to. Patients love them. I have not had a single patient that has given up on it. So they're very comfortable. They do allow vertical movement and some horizontal movement. So that makes me feel good with the muscles and the jaw joints. So I'll pass these around. This one's the Somnodent. Another one that I use a lot are the Oasis. And the Oasis is one that's currently undergoing some revision because we've had some problems with them. That one is really nice and bulky. This one's a little bit more problematic in that it's not as strong. And so we have had some cracking and so forth that way. It also is not as easily adjustable. With that appliance, a lot of my patients are out-of-town patients. They come from a long ways. I can teach them how to adjust that so that if I tell them over the phone, how you getting along, how you feeling, okay, move it 3 turns in the direction of the arrow on each side. And so that works great for me for long distance people. This one I have to adjust because there's no gradations for marking on it. And the thing I liked about this originally is these 2 little blue things. They work kind of like a Breathe Right strip in reverse. They fit inside, but they do open the nasal passages. So it does give more airflow. But this is currently being totally redesigned. We thought we were going to have, or they were going to have it for introduction in June, and didn't happen. So I'm looking for sometime this fall. But you can just see this is not quite as hefty. This is one that you may hear about a lot. I don't like it. I don't use it. It's called the tap appliance. And what it does is it is adjustable, but this locks into that, okay? Well, what's this mean? The patient can't open their mouth, okay? They're locked in. Now, if we have a grinder and a clencher going on, this is what they hear all night long, because they're playing with these little points on this appliance. I had a patient from Des Moines who was sent up because they had a T-tap and they were having all kinds of trouble with their teeth. Their front teeth were getting loose. Well, they were Bruxer. They were grinder and clencher. So all night long, they're working on that. The lower teeth were flapping in the wind. So this is one, I'll pass it around. I don't like it. I've talked to the company and I said I'm not going to use it until you change that mechanism. This is a nice little entry-level appliance. It's called the Emma, and it was really the first quote-unquote adjustable appliance that allowed some freedom of movement on the market. And it's pretty simple, relatively inexpensive, and you adjust it by changing the color of the bands, okay? Now, the only downside to this is I have trouble changing the bands. They're so tight in getting them over these hooks. So a patient, you know, particularly somebody who may be arthritic, is going to have a big fight. So, you know, this is a good entry level. It's limited use, but it is another tool for the toolbox. So those are the main workhorses that I use. There's a lot of other ones out there. And here's our Emma that we just talked about. There's the little bands that we use. And then we can get kind of snazzy little metal pneumatic pump type things. In essence, they are adjustable. The Hilson positioner, it looks like Velcro on there, so where we put the Velcro sticks. I mean, I think a lot of these guys just wanted their name on an appliance. The Clearway, the silencer, this was originally designed for snoring. Snoraid, Therasnor, Thornton adjustable, the tap that I don't like. And just like everything, they have some side effects, and we need to be aware of them. They can cause some changes in the bite, some occlusal changes. Now, I have not seen that in but a very minor number of cases. But part of the reason, I think, is that I have the patients use, when they take the thing out in the morning, you know, think about it. The jaw is going to be forward a little bit. That means the jaw joint's going to be forward a little bit. And so we're going to get some tissue fluid buildup behind the head of the jawbone. And so when we wake up in the morning, we go to bite together, the teeth don't fit right. So what we do is have the patient bite on this while they're taking a shower. Just do that a few times. That pushes the fluid back out. And I just have not seen occlusal changes with it. So that was one of the things that in our academy, you know, everybody was really concerned about occlusal changes. And one of the, I'll pass this around too, one of the guys was one of the head honchos. He said, well, he said, are you going to worry about the bite changing a little bit or not breathing? So it's all a relative issue. I don't care if the bite changes a little bit. It's usually only the dentist that gets concerned about that. The patient doesn't care as long as they're breathing. We can get some jaw pain and discomfort like we talked about, and then tooth pain and discomfort, the tap appliance, okay? And here's a combination appliance, combined oral appliance and CPAP. And I really like the concept. I've done a couple of them. I like them. I think that that's kind of maybe a wave of the future.